Where should I be looking?
Hello, everyone, and welcome back. An Eye in Health right now. November is also called Movember. You may know that. It's also an event and an important time to raise awareness for men's health issues. And joining us now, we have Dr. Joshua Jew. He's a urologist with Palm Beach Health Network. We understand that you are right now in Good Samaritan Medical Center as well as in a hospital in Palm Beach Gardens. Is that correct?
That's correct.
Okay, wonderful. Thank you so much for joining us. Men's health. That is the focus on our Eye in Health segment today. Let's start with erectile dysfunction, right? How common is that right now?
Erectile dysfunction is very common. First of all, erectile dysfunction, for those who don't know, is the inability to achieve or maintain an erection that's satisfactory. Erectile dysfunction is very common, but unfortunately underreported, because both patients and physicians may feel uncomfortable discussing this topic.
Sure.
By age 40, approximately 40% of men may have some element of erectile dysfunction, and by age 70, up to 70% of men. Erectile dysfunction can increase in prevalence with age, as well as other medical problems.
Okay, so something like that, if they see any of those symptoms, to always consult with a doctor. Is that what you recommend? Let's go to another topic here that we understand that there is possibly the link between that cardiovascular health as well. Let's focus on that.
So erectile dysfunction is actually associated with cardiovascular disease. More specifically, erectile dysfunction is associated with asymptomatic coronary artery disease, as well as the risk of a cardiovascular event in the future, such as heart attack or stroke. And that's why the European Society of Cardiology actually recommends cardiovascular risk assessment in patients with erectile dysfunction.
All right, well, talk to us about what men should do. I think a lot of, from what we hear and what we read, of course, is that men don't really go to the doctor as much. So what is it that you want to tell those who are watching who may have a father or brother who kind of neglect those yearly exams? What do you want to say to them?
Well, you said it best. I mean, men can neglect their health, not regularly visit a physician for a routine checkup, especially if they don't think anything's wrong with their body. Erectile dysfunction can be a man's first sign that something may be wrong with their health. So as I mentioned earlier, erectile dysfunction is strongly associated with cardiovascular disease, so that may be the most important reason to seek evaluation by a physician. However, erectile dysfunction can also negatively impact both a man and their partner's relationship, mental health, and overall quality of life. So I believe that the stigma surrounding this topic should be removed, and men should seek evaluation and treatment regardless.
So interesting, too, how you mentioned that. It's just that some people, I imagine that there's that stigma. They don't want to be open about it or talk about it. And those are just some great tips, because cardiovascular disease is also so important to tackle in advance. And if you have any of those signs, seek a doctor right away. Well, Dr. Joshua Jew, thank you so much for joining us. That's all the time we have. All right, we'll be right back.